The reality of the rising wave, whose bitter fruit is more infectious and deaths, seems to be hitting home for some who are dismissing the disease. Sadly, not all are on board this safety flight, but the situation is dire. Hospitals are bending over backwards and their spines are unable to hold. Various doctors and hospitals are confirming that intensive care units are full, with many in need of facilities yet to secure space. Covid-19 isolation wards are also hard to come by, but the patient numbers are rising daily and hospitals are feeling the strain daily. Seth Olale lifts the veil over why you need to be alive to the horrid and morbid reality of the most lethal COVID wave Kenya has experienced.
Another frontline soldier has fallen while in the battlefield. Dr. Kenyan Mutuma, who was a doctor at Mbagathi County Hospital, succumbed to COVID-19, and the Kenya Medical Practitioners and Dentists Union has celebrated him as a diligent and inspirational doctor. This comes just after the country registered its highest number of fatalities in a day, 28 deaths in 24 hours. Kericho Deputy Governor Susan Kikwai has also lost the battle, coming after a host of other Kenyans, including public figures, either getting infected or dying. ODM leader Raila Odinga, Meru Governor Keraito Murungi are among the leaders who have publicly declared that they are COVID positive, and these are not the only leaders who are battling the illness.
We have governors in hospital, we have senators in hospital, we have members of parliament in hospital, we have young people, we have old, we have poor people, we have rich. This thing haibagui.
Some medics have taken to social media platforms to warn Kenyans to be vigilant, saying that some people are failing to get the treatment they need as hospitals are full. They claim getting an ICU bed is a chance affair and COVID-19 wards have no available space. If you get the disease and can't even afford a private hospital, you may not get the space. It is not a guarantee. Medics are also pointing out that many of the new patients have underlying conditions and are also going in while in critical condition.
We are a bit stretched. That I must admit we have been stretched in terms of capacity. And this is the exact reason why we didn't want to be able to get to a situation where we had the surge which we're experiencing at the moment. According
to the Ministry of Health data, 3,250 people in the country are still battling the virus, just at different stages. Further, the number of patients in critical condition has significantly increased in the past few weeks, with 123 patients under intensive care. So dire is the situation that political leaders who are leading the way in breaching the rules and exposing wananchi to the killer disease are now speaking in a different tone.
Be very, very, very careful with the second wave. It is real. We must not lower the guard.
Let us be strict in the adherence of these COVID protocols. Like you have seen, this wave that we are currently in as a country appears to be perhaps more lethal. Third wave is back. It is lethal. Let us continue to observe regulations and protocol issued by Ministry of Health.
Various public spaces are still sporting wananchi going about their daily business without regard for the containment measures, even as the third wave swallows more. The Ministry of Health said it is considering returning the stringent measures such as lockdowns in counties in light of the rise in infections and deaths. Seth Olale, NTV.